Good morning, everyone. Today, I will be presenting a comprehensive evaluation of the MATATAG, PE, and Health curriculum using Stake's Congruence-Contingency model. This model helps us understand how well the curriculum aligns with our educational goals and how any challenges that may arise can be addressed. For our executive summary, this report evaluates the PE and Health MATATAG curriculum through Stake's Congruence-Contingency model, aiming to ensure the alignment with educational goals while addressing external challenges. The evaluation encompasses three main aspects: the intended curriculum, implemented curriculum, and achieved curriculum, along with contingency planning for external factors. The evaluation underscores the importance of aligning curriculum goals with effective teaching practices and learner outcomes. Recommendations include enhancing interactive activities, providing ongoing professional development, and implementing robust assessment practices. Strategic contingency planning ensures resilience against external challenges, supporting continuous improvement and learners' success in the PE and Health MATATAG curriculum. In this slide, you will see the front cover of the MATATAG PE and Health curriculum for grades 4 to 10. Now let's proceed to the curriculum evaluation model using Stake's Congruence-Contingency model. The purpose of this evaluation is twofold: to ensure that our curriculum aligns with our educational goals and to anticipate and address any challenges that may come our way. Stake's Congruence-Contingency model was used, which allows us to assess the intended, implemented, and achieved curricula and identify any external factors that may influence these elements. Let's start by identifying the intended curriculum. This involves defining the educational objectives and outcomes that the curriculum aims to achieve. For the MATATAG PE and Health curriculum, I have identified 5 key components: the development of physical fitness, enhancement of motor skills, health and wellness education, promotion of lifelong healthy habits, and a comprehensive education approach. To delve deeper into the intended curriculum, the curriculum focuses on improving students' physical fitness by enhancing cardiovascular health, muscular strength, flexibility, and endurance. It aims to develop motor skills such as coordination, balance, agility, and fine motor skills. Health and wellness education covers topics like nutrition, personal hygiene, mental health, and the benefits of regular physical activity. It encourages lifelong healthy habits, promoting regular physical activity and healthy dietary choices. The curriculum takes a holistic approach addressing cognitive, psychomotor, and affective domains. Next, the implemented curriculum was examined. This involves evaluating how the intended goals were translated into classroom practices, teaching methods, and student engagement. 7 key aspects were the focus: teaching methods, materials and resources, integration of PE and health education, student engagement and participation, teacher professional development, classroom environment, and stakeholders' feedback. Starting with teaching method and resources, the use of interactive and engaging approaches were assessed, such as group activities, discussions, hands-on exercises, and practical demonstrations. It's important to consider the variety of teaching methods employed to cater to different learning styles and maintain high levels of student engagement. The availability of quality of resources and materials were also evaluated, including equipment for physical activities and textbooks for health education. It was then explored how PE and health education were integrated. Lesson planning should ensure the seamless incorporation of both subjects rather than treating them in isolation. Cross-curricular connections were also investigated, where health education concepts were reinforced through physical activities, promoting integrated learning experiences. Student engagement and active involvement were critical, along with effective methods for monitoring progress and evaluating achievements. Teacher professional development and the classroom environment were also key areas. Teachers should receive adequate training and professional development opportunities to enhance their ability to deliver effective PE and health education. Adherence to safety protocols were evaluated during physical activities and whether the classroom environment supports effective teaching and learning. Innovative practices implemented by teachers were identified to promote continuous improvement in teaching methodologies. Lastly, stakeholder feedback was considered. Perspectives from students and parents were gathered regarding their experiences with the PE and health curriculum. This feedback provides valuable insights into the curriculum's effectiveness and areas for improvement. Now we move on to assessing the achieved curriculum, which focuses on evaluating the actual outcomes and impact of the curriculum on student learning and development. This includes standardized tests and assessments, observations and teacher feedback, surveys and self-assessments, portfolio reviews, demonstrations and presentations, longitudinal assessment and data analysis and reporting. Several methods for evaluation were used. Standardized tests measure students' knowledge of health concepts, physical fitness levels, and practical applications of learned skills. Teacher observations provide performance evaluations and insights into students' engagement. Surveys gathered student perspectives on their learning experiences, while self-assessments offer personal insights into the curriculum's impact on their lifestyles choices. Portfolios and demonstrations were valuable tools. Student portfolios contains projects, reports, fitness logs, and reflections on health-related activities demonstrating progress in various skills. Practical applications such as presentations, practical exams, or simulations were assessed, with peer and self-assessment components providing additional perspectives on students or on student performance. Longitudinal assessment tracks changes in students' health behaviors and outcomes over several years, providing insights into the long-term impact of curriculum. Data compilation and analysis generate comprehensive reports on the achieved outcomes. Recommendations are formulated based on assessment findings to inform curriculum adjustments, teacher professional development needs, and resource allocation. Now, evaluating congruence involves assessing the alignment between the intended, implemented, and achieved curricula. The focus was on teaching methods and materials. Do they effectively support the intended learning goals? For student achievement, are students achieving the expected outcomes in terms of knowledge acquisition, skills development, and concept application? Identification of gaps. Any discrepancies between the intended curriculum and what was actually achieved were identified. Now, we reflect on the evaluation findings to identify areas for improvement and develop strategies to enhance alignment between the intended and achieved curriculum. Recommendations were provided to promote effective curriculum delivery and student learning outcomes. Now, contingency planning is crucial for addressing external factors that may affect curriculum implementation. Identifying external factors was the start, such as resource constraints, logistical issues, and community and environmental factors. We adopt the curriculum based on identified external factors, adjust teaching strategies to accommodate constraints, revise and supplement learning materials to address specific challenges, provide targeted training programs and workshops for teachers to enhance curriculum delivery, explore technology integration opportunities to facilitate remote learning or supplement classroom activities. Now, strategic considerations includes developing proactive measures to mitigate the impact of external factors, develop contingency plans to address unexpected disruptions, Engage with stakeholders including parents, community organizations, and local authorities to garner supports and resources. Next, establish feedback mechanisms to regularly assess the effectiveness of contingency plans and adopt strategies as needed. In conclusion, the evaluation of MATATAG PN Health curriculum using stakes congruence contingency model was provided valuable insights into its strengths, areas for improvement, and enhancement strategies. By aligning curriculum goals with effective teaching practices and student outcomes, it can be ensured that continuous improvement and student success. Proactive planning helps mitigate external challenges and optimize curriculum delivery, fostering a supportive environment for student learning and well-being. And this is the end of my presentation on comprehensive evaluation of the MATATAG PE and Health curriculum using stakes congruence contingency model. Once again, I'm Irvin T. Echage and thank you for listening.